Hey, my name is Kara. I'm an ultrasound tech, and welcome to my channel where I talk about all things ultrasound. If you guys haven't already, please go ahead and subscribe to my channel, and also like and comment on this video here if you have found it informative or if you have any questions. Today's video is going to be about gestational diabetes. For those of you that don't know, gestational diabetes is when mom develops diabetes during pregnancy when she did not have it prior to pregnancy. Diabetes is when the body is actually not making enough of a hormone called insulin, which is produced by the pancreas. And this hormone is actually responsible for taking the sugars that come in through your food and then in your bloodstream into the cells of your body to make things such as energy. So, when you are not producing enough insulin in your body, the blood sugar is going to remain high because it is unable to get out of your blood into the cells to do what it needs to do, and therefore, obviously, your cells are not going to be getting that sugar to be able to function. And the sugar will just remain in your blood, which is why with people that have diabetes, their blood sugars are high. Now, the scary thing about gestational diabetes is many patients who end up developing it during pregnancy actually do not have any symptoms. And it's not until the gestational diabetes test that is done between 24 and 28 weeks that they find out they have gestational diabetes. This is a really important test for you guys to do because not only can you present with no symptoms and basically not know that you have diabetes, but if left untreated, it can be fatal to both mom and baby. You can develop things such as preeclampsia, which is really high blood pressure in pregnancy, which again can be fatal to both mom and baby. Not to mention the fact that a lot of the time the baby ends up being very large when mom has gestational diabetes, and that can lead to complications during birth, such as shoulder dystocia, and also complications after birth as well, because baby's body is producing a lot more insulin than what is needed if mom did not have gestational diabetes. And this is because the blood sugar is going to cross through the placenta into baby, but the insulin that is produced by mom's body is not going to pass through the placenta. So essentially, mom's blood sugar is going to be high, and therefore baby's blood sugar is going to be high. And then baby needs to actually compensate for that high blood sugar by producing more insulin of its own. By the time the baby is born, obviously it will not actually have that really high increase of blood sugar levels but that it was getting from its mom. And that again will lead to complications in baby if the doctor does not know about the gestational diabetes and if it was left untreated. Which, again, to circle back, that is why it is so important to do the gestational diabetes screen from 24 to 28 weeks, because most people end up developing gestational diabetes around the 24-week mark. If you are at higher risk for developing gestational diabetes, though, your doctor may recommend that you get the test a little bit earlier on. But for most people, that 24 to 28-week window is going to be an ideal spot for you to get that test. It's also important to note that about half of those who have gestational diabetes will end up developing type 2 diabetes after baby is born. But if you do get your weight down to a healthy, manageable level after baby is born, then that risk does decrease dramatically. So let's talk some more about what the gestational diabetes test actually entails. And I did want to make a note that this video was inspired by the trend that I have been seeing on TikTok. And it first came up on my For You page by one of the people that I follow on TikTok, Jen Hamilton. And she is a labor and delivery nurse. And basically, she was saying that she has seen an uptick in a trend that is occurring that is really, really alarming. And that trend is to flat out refuse the gestational diabetes screen or use an unproven source of sugar for that screening test. Both of these things, again, can definitely lead to either you not being diagnosed at all with gestational diabetes because you simply did not do the test, or your gestational diabetes was missed because you did not drink the proper drink that you were supposed to, the glucola drink, and therefore substitute with something like jelly beans or Pop Tarts, which are not proven to be effective in screening gestational diabetes like glucola is. But, anyways, I do digress. So, with the gestational diabetes screen, what is going to happen is between 24 and 28 weeks, you are going to go into the lab of your choice, and they are going to give you this very sugary, flat, usually orange flavored drink. It is called glucola, and it is going to taste super sweet, A lot of the time, they do keep it in the fridge now, which is nicer for moms to drink, but you have to drink it in a certain time frame, and then your blood will be tested in an hour from the time that you finish drinking it. So if your blood sugar is elevated at that point, then what is going to happen is you are going to get a second gestational diabetes screen where you are given an even sugarier drink, so a drink with even more sugar in it. And then your blood will be tested once an hour for the duration of 3 hours. If again your blood sugar levels are high, as in it is indicating that your body is not producing enough insulin to take that sugar out of your blood and into your cells to make things like energy, then you will be diagnosed with gestational diabetes, and you and your doctor will come up with a plan as to what the treatment and management of that is going to look like. Usually, things such as looking at your diet, exercise, your lifestyle overall, as well as getting scans at regular intervals in the third trimester. So, basically, at 28, 32, and 36 weeks is kind of the norm to monitor baby's growth, is all part of a normal gestational diabetes management plan. For some women, though, the lifestyle changes and the monitoring with ultrasound, as well as the close monitoring with extra doctor's appointments, is still not enough to get the gestational diabetes under control. And that's when insulin is going to be prescribed to mom to, again, get that sugar out of the blood and into the cells like it is supposed to. Another important note about monitoring with ultrasound is although we are the best and most accurate way to determine baby's weight when baby is still in utero, we are still far from being accurate in the third trimester. Having a growth scan at these intervals is really important just to see the trend of how baby is growing, but at the same time, so many factors goes into actually getting a accurate weight determination of baby that oftentimes it is a margin of 1 to 2 pounds on each side of what we are estimating the weight to be. Usually, though, if baby is falling, let's say in the larger percentile, like in the 80th percentile, it is going to kind of stay on that trend for the duration of the growth scans. So the weight doesn't necessarily matter that much, but we are more looking at those growth percentile charts. But another interesting thing about gestational diabetes, which I learned from the woman that I follow on TikTok, the labor and delivery nurse Jen Hamilton, she did say that many of these babies whose moms have gestational diabetes end up gaining a lot of weight in the upper torso area. So, with ultrasound, when we are doing those growth scan measurements in the third trimester, we are taking into account the measurements of the head, the belly, as well as the arms and legs. We are not, though, taking into account the measurement of how big this like upper torso area is, which again can be dangerous for sure for delivery if not only are we underestimating how big baby is with ultrasound because we are simply not looking at that area, as well as it does then increase the risk of baby getting stuck with the shoulder, which again I mentioned earlier on in this video that that is called shoulder dystocia, and that can be life threatening for both mom and baby. And I think there's only about a couple of minutes from it actually happening to it being life threatening for both mom and baby. So hopefully you guys can see how important it is to do the gestational diabetes screen when you are supposed to at 24 to 28 weeks, and to make sure that you are getting your information that you are using for your pregnancy from a credible source. I know that with anyone who is expecting, or at least for the majority of people, anyways, you want the best for your baby as well as the best for yourself and your whole pregnancy overall. And it can be really, really easy to fall down some of these rabbit holes that we see now on social media just because everything is so accessible nowadays. But if you ever see something on TikTok or on YouTube or just, something on the internet that you are questioning whether or not you should be doing a standardized test, or just any questions in general about things you should be doing in your pregnancy, your doctor is always the best person to ask because obviously they know your case personally because again they are your doctor, they know your past medical history, they know how your pregnancy is going so far. And for those of you who definitely have told me that you don't really trust your doctor, easier said than done, I know, but maybe it is time to find a new doctor or even just consult the opinion of another doctor, let's say at a walk-in clinic, something of that sort. But either way, always take anything that you see on the internet with a grain of salt, especially when it could lead to life threatening complications for both you and baby. If you ended up, heaven forbid, blindly following this trend or this advice that people are just spreading on TikTok that They're not going to do the diabetes screen or using an alternative source of sugar that hasn't been proven effective. And like usual, if you guys have found this video informative, please go ahead and like this video, comment on it if you have any video suggestions or any questions, and subscribe to my channel as well. I also make TikTok videos, as I kind of alluded to with the beginning of this video, so definitely follow me over there as well.